Do you have shoulder pain? You know what to do to fix it? What could be the reasons for it? Then this video is the right video for you. Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to yet another video. We're going to be talking about shoulder pain, its causes, and what can you do for it. This is your shoulder joint. It's a ball and socket joint. The ball is big and the socket is small, much like a golf ball on a tee. So it's basically a rather unstable joint. To stabilize it, what God has done is He's made the socket a little elevated on all ends, like a banking in a Formula One or a bike racing track, to prevent the rider from falling off the track. How does He do that? He puts a little rubbery thing around it called the labrum. Apart from that, there are a lot of muscles around your shoulder. These muscles move your shoulder. They come and attach onto the shoulder via ropes called tendons. These are attached onto the ball like this. Above these tendons is a little bone on top called the acromion. There's also a joint between the collarbone and the acromion called the AC joint, and between the collarbone and your chest bone called the sternoclavicular joint. Now, what are the causes of pain here? Number one cause is aging. We call it arthritis. So if cartilage goes away on either the ball or the socket, it can cause it rubbing against each other, friction and pain, much like the knee. Pain, swelling, inability to move the shoulder completely. Elderly individual, always think arthritis. A similar presenting condition is when there's stiffness. Younger patient, could be older also, any age group, gradually progressive stiffness, pain, unable to sleep on that side, movement is slowing down. Could be a frozen shoulder. More common in diabetics. On an X-ray, it's all normal. MRI, it's all normal, but it's a clinical examination. So arthritis, unfortunately, doesn't settle on its own. We just need to make sure the pain is controlled. But a frozen shoulder is treatable. It's a self-limiting condition. Usually in 6 months, becomes okay on itself. In other cases, sometimes an injection is required, physio in all cases, and very rarely an operation, an arthroscopic surgery. Sorry to disturb you, but if you're enjoying this content and you want to know more and you have people that are suffering from this problem or you're suffering from this problem, please call the number below. My team will be able to fix an appointment with me either in person or through a video call to help you. Thank you very much. Apart from that, these ropes or tendons can tear. We call them rotator cuff injuries. They happen because of falling, lifting. Sometimes in the elderly, very trivial trauma, they can break. They can cause pain. These need to be repaired back through an arthroscopic surgery to fix them back. Typically, such patients are just not able to lift their hand up. Not much pain after some time, but just not able to lift it. No ability. Can lift it with the other hand, but not on their own. Apart from that, you're able to lift it. There's pain when you take it beyond at a particular angle. It could be that these ropes are hitting the bone on top that we call impingement. These do very well with physiotherapy, sometimes an injection, and rarely an operation where we create more space between the bone on top and the ropes at the bottom. Certain people are more predisposed to it, like those who have either a longer bone here, call it a type 2 acromion, or those that are into activities that could potentially cause these ropes to hit on top. Apart from that, there could just be tendonitis, that is where these ropes are attached to the bone. If the muscles are weak or there's a lot of repetitive activity, there's a lot of strain on them and they can cause swelling and pain. So in simple words, it's like a rope that you dry your clothes on. It's attached to two ends of the wall. Keep jumping on it. Maximum strain is where it's attached to the wall. It can break off or they can be strained there. When they're strained, we call it tendonitis. When it breaks off, we call it a rotator cuff tear. There can also be arthritis of the other joints of the shoulder complex, like the acromioclavicular joint where pain is right on top, or between the chest and the clavicle, sternoclavicular joint. We call it AC joint arthropathy or sternoclavicular joint arthropathy. They can also cause pain and cause difficulty in moving. Apart from that, if there's instability in the shoulder, certain people that are very flexible or have had injuries where the ball has come out of the socket and come out, this banking flattens out, and every time the ball goes out and in, it rubs against it, causing pain. In these patients, a surgery may be required arthroscopically to basically repair back this particular labrum. Another very important structure that's very painful in the shoulder, contrary to popular belief, do you know the biceps originates in the shoulder and goes down to the elbow? So the biceps, where it's attached on top to the shoulder, can be under a lot of stress, and that causes something called biceps tendonitis. Classically, pain when you work out here in the front of the shoulder could be biceps tendonitis. This needs to be identified, usually does well with physiotherapy, sometimes an injection and rarely an operation. Also, where the biceps is attached to this banking, that banking can tear off. We call it a slap tear. That's typically identified with pain in overhead activities at a particular angle. This may need surgical treatment to repair it or may do well with physiotherapy and an injection. I hope you've got a lot of information about causes of pain in the shoulder, but remember, go to a specialist like me, get yourself evaluated. They will clinically examine you, come to a conclusion, and then get tests like an MRI and ultrasound to confirm the diagnosis, and an X-ray sometimes to confirm the diagnosis and to tell you what you actually have. Once you know it, then appropriate treatment can be given. If you like my video, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a popular Hindi channel which has a silver play button. Please like, subscribe and follow it. And those who like Instagram, please follow me on Instagram, Knee Surgeon in Delhi. Thank you very much.